Hi everyone, thanks for joining me on this webinar about understanding COVID-19 and how CareFirst can support you. I'm going to tell you a little bit about the basics around COVID-19 and I hope you find it useful. But for more in-depth information, please use the article that was also produced today. It has a jargon buster and it also has some very useful links at the end of it. Okay, let's get started. So we're going to have a look at the basics of COVID-19. We're going to have a look at some coping strategies to the stress and pressure that you may be experiencing. And hopefully you'll be able to give you some calming coronavirus anxiety tips and also how CareFirst can provide you with support. So, where did the name actually come from? Cases of COVID-19 first emerged in late 2019. When a new illness was reported in Wuhan in China. The cause of the disease was soon confirmed as a new kind of coronavirus. Coronaviruses are a group of viruses that usually cause mild illness, such as the common cold. On the 11th of February, the World Health Organization announced the official name would be COVID-19, a shortened version of coronavirus disease 2019. The World Health Organization refers to the specific virus that causes this disease as the COVID-19 virus. Now, this isn't the formal name for the virus. The International Committee on Taxonomy of Viruses actually call it Severe Acute Respiratory Syndrome Coronavirus 2, or more commonly shortened to SARS-CoV-2. That's because it's related to the virus that caused the SARS outbreak in 2003. However, to avoid any confusion with SARS, the World Health Organization called it COVID-19 virus when communicating with the public. So confirming cases, and what does that actually mean? The World Health Organization definition of a confirmed case of COVID-19 is a person shown by laboratory testing to be infected with the virus, irrespective of clinical signs and symptoms. However, some reported case numbers from China have included people with symptoms of COVID-19, but without lab confirmation. So what are the common symptoms? The most commonly reported symptoms include a fever, a dry cough, and tiredness. And in mild cases, people may just get a runny nose or a sore throat. In the most severe cases, people with the virus can develop difficulty breathing and may ultimately experience organ failure, and unfortunately in some cases this can be fatal. The virus can also be asymptomatic, which means it causes no noticeable illness in some people, but these people are still contagious and can spread the virus. On the 11th of March, the World Health Organization announced that the outbreak should be considered a pandemic, a term that has no universally agreed definition. Means that multiple countries are seeing sustained transmission between people of an outbreak causing disease or death. So calculating fatality rates and why is it so difficult? The risk of death has been difficult to calculate as it relies on the accurate numbers of those who have symptoms survive the illness. In some countries, including the United Kingdom, have been slow to increase capacity for testing. Therefore, calculating the fatality rate can differ from country to country dependent on the accuracy of their data. So the spread of COVID-19 is largely spread via droplets in the air. These are typically expelled when an infected person coughs or sneezes. Once symptoms develop, a person's viral load declines steadily and they become increasingly less infectious. However, people appear to keep shedding the virus for around 2 weeks after they recover from COVID-19, both in their saliva and stools. This means that even once a person's symptoms have cleared, it may still be possible to infect other people. People with mild or no symptoms can have a very high viral load on their upper respiratory tracts. meaning they can shed the virus through spitting, touching their mouths or noses and then a surface, or possibly even talking. The new coronavirus has also been found to persist for days on surfaces, though that doesn't necessarily mean these virus particles can still infect people. It could also be diminished by things like ultraviolet light, heat, or humidity. So at times like this, it can be a very stressful time, and not knowing what and who to listen to can cause a lot of stress and anxiety. So what are the definitions? The definition of stress is an adverse reaction people have to excessive pressure or other types of demands placed on them. And anxiety is a feeling of worry, nervousness, or unease about something with an uncertain outcome. There are a number of different ways pressure and change and stress can affect us all, from the way we think to our emotions, right down to how we behave. Anything from loss of concentration to drinking too much and feeling tired all of the time. It is very, very easy to miss what our body is telling us. At times like this, it is very good to be self-aware. These are just a few ways in which it can affect us. So what are the signs of pressure? Reduction in output or quality of work. Now we say that, but we also know in times like this where people have had to change the way that we work can have an impact on that as well. So if the quality of your work has gone down or the output has gone down, and that's not due to the fact the way you're working has changed, then it could possibly be a sign of too much pressure. Also making frequent mistakes, impaired judgment, rapid or frequent mood swings, growing loss of temper, growing introversion, poor grooming, hasty decisions, and also poor memory. So here's a number of ways that can reduce pressure on yourself. So always ensure you have a proper, healthy, well-balanced diet. Make sure you exercise as much as possible. Always talk about your problems. Learn to relax. Try to avoid bottling things up. And do just one thing at a time. Plan and manage your time. Be positive and identify sources of your stress. It's important at times like this to remember your support systems around you. It's a very strange time for everyone. For the first time in our lives, we have been told that we can't go and see family, friends, and a lot of us won't even be able to see colleagues. Therefore, our support systems, as we know them, no longer seem to be there. But remember, they are there, and it might just be a case of changing or tweaking how you communicate with them. So remember, Skype your family often, call your friends regularly, and even email and chat with your employer. One great thing to come out of this situation, there are online communities that have formed, groups of like-minded people, all with the same thoughts and feelings, that can be a great lifeline or support network for you. You just need to find the ones that suit you best. So here are a few tips on how to remain calm during coronavirus. So always follow the advice from experts. Don't always believe what you read on social media, and just keep your knowledge up to date. Know what to do to avoid the spread of germs. This not only helps keep you safer, it gives you a sense of control. Follow expert guidelines for health and safety. Wash your hands well and wash them often. Keep surfaces clean, stay at home, keep a safe distance from others. When you do these things, you protect yourself, your family, and your community. Accept anxiety as one of your many emotions. Don't ignore it, fight it, reject it, or be afraid of it. Don't judge yourself for feeling it, and be kind to yourself. Give yourself permission to be a human. Keep everything in perspective and notice the good. Don't let anxiety run the show. It's one part of your emotional life, but not the whole thing. Leave room to challenge yourself. Think to yourself, is there anything going well? What positive things have happened that make me think this anxious thought might not be accurate? Direct your attention. When you notice anxious thoughts, know that you don't have to dwell on them. Direct your attention to things that help you feel calm. Practice breathing. Just pausing to take a breath can calm you in difficult moments. Help you pause before you react and choose how to react. Specifically, things like belly breathing or diaphragmatic breathing are most helpful. Practice for maybe 5 to 10 minutes a day. There are loads of free apps on the App Store that can show you how to breathe properly. Remember to reach out to others. Staying in contact with friends and family is good for you as well as them. Feeling close to others reduces anxiety and has been known to boost the immune system. Even though we're staying home, we can reach out by phone, video chat, or social media. We can feel close even while we're apart. Practice physical distancing but social togetherness. Remember to be active. Even though we're staying home, find ways to be active every day. There are plenty of ways to be active outdoors and still practice social distancing. Exercise relaxes you. It generates hormones that then boost your body's immune system. If you can't get out, take a fitness class online and remember to watch our webinar about looking after your physical well-being. Keep your balance. Calming anxiety doesn't mean ignoring your problem. It's about finding your balance so we can cope well, so we can help ourselves and each other in this situation. We can find calm and well-being even when we face great uncertainty, and know when to reach for help. If your anxiety seems overwhelming, if you're having trouble sleeping, eating, or interacting in the ways you normally would, get some help. Don't be afraid to reach out for help during this stressful time. And that's where Care First can come in, to help you through the difficult times and be there as part of your support network. So how can we help you? We have a 24-hour-a-day, 7-day-a-week counselling line that is there for you to use free of charge. You can talk to us about anything and we will always endeavour to help you. You will speak straight away with a BACP accredited counsellor. Because everyone has very individual needs for support, Care First provides short-term focused counselling. So the Care First counsellor will assess you in your circumstances when you call to establish what the most appropriate form of support for you would be. Or you may wish to talk to one of our telephone information specialists, often referred to as a TIS. They are citizens advice trained and are all money trained experts. So whatever your practical question or advice needs, they will be able to help you or signpost you in the right direction to get the help that you need. And don't forget our lifestyle website. The website offers extensive resources, including articles on health, issues at home, issues at work, management support tools, stress questionnaires, and online counselling in real time. And of course, regular updates and information on the situation in hand. And remember, just because things have changed significantly around us, it does not mean that our everyday lives have halted completely. So please don't think we're only here to support you with COVID-19. We're here for everyday issues you may be experiencing. And this is a list of issues that we are well versed in dealing with. But obviously, we are not limited to just these issues. Care First is a completely confidential service. We're completely separate from your organisation and your confidentiality is absolutely paramount to us. However, there are 3 occasions that we would break confidentiality. And they are: 1, if there is a threat to the life of another person; 2, if there are any child protection or vulnerable adult issues; and 3, if there is a risk to the security of the organisation. And that could be physically or data. So please, if you do need to contact us, feel free to contact us whenever convenient for you. To find out your phone number for your organisation, log on to the Care First Lifestyle website and feel free to contact us. Thank you for listening, and if you have any questions, please feel free to email the info@care-first.co.uk email address. Thanks very much.